Now the last portion of doing the veneer preparation is dialing in the preparation margins. Now for this preparation, I'm not driving the margins through the lingual. I'm going to leave them facial to the contact. So I'm going to use that same burr, that 6847, and probably using the fine diamond at this point, and I'm going to start angling my burr. As you'll see in the illustration, I'm going to start moving the burr into the contact zone, just facial to the contact margin. And I'm going to, as you can see, I'm going to run the burr down in this illustration so I bring it all the way to the incisal so that I can drop the margin down interproximally. I'm going to follow along the gingival margin and then follow along towards the distal. And watch how the burr changes the angle as it's working into the interproximal so that I can drive the margin into the proximal. What's critical is to remember that the delivery of the veneer is going to be from the incisal facial because of the preparation we did on that incisal. So we can have this sort of nice defined preparation along the interproximal, through the gingival, through the other interproximal. The veneer will seat right down into that. So the final thing when I'm done with my veneer preparation is to make sure I don't have any sharp edges or sharp corners. So I'll go back with my disc or maybe a rubber wheel or rubber point and make sure that everything is super smooth, that by using these depth grooves, I know I have uniform reduction. I've evaluated to make sure the margin is ideally placed based on the situation. I'm ready to go forward and then take my impression. So you can see my burr, I'm trying to make sure I keep my 3 planes of contour. And I'm just going to work over that cervical margin and get that nice and smooth. And over the facial, I'm going to be looking for any rough areas and any areas where I haven't blended nicely. Now I'm going to start working towards my interproximal. See how my handpiece, the angle of my handpiece, as I want to drive the margin interproximal. I've literally turned my handpiece so that I can get that burr tip running right along so I can push that margin right towards the proximal contact point. And again, showing that again, take a look into the mirror on this image and you can see how that burr is following along. Now obviously on these plastic teeth it's a little tricky because these teeth prep so easily, but trying to get a nice smooth margin and then changing the angle of my handpiece as I drive the margin into the proximal. Alright, so let's take a look at the preparation. Just looking at the flow of the tooth preparation, looking at the 3 planes of preparation. And working with laboratory technicians over 30 years, what I've heard from them most consistently with anterior porcelain aesthetics, either with porcelain veneers or porcelain crowns, the area of the tooth that is most often under-reduced is the incisal third. That's critical because if the incisal third is under-reduced, one of 2 things is going to happen. Number 1, you'll get shine through of that incisal third through the veneer, especially if you're doing a very thin veneer. So you'll be able to see the tooth structure shining through. The other thing that happens is that it's difficult for the porcelain to be able to have a transition zone between porcelain and tooth. And without adequate reduction in that incisal third, it's very difficult for the lab technician to be able to hide that transition zone. And very often they have to bulk out the incisal third of the veneer, which makes the tooth look just not as ideal and not as aesthetic.